Hi there. We're here with our patient Will. Will's back again after about 5 years. He came during the COVID years. He had a previous procedure with Bosley, and he did a smaller case, and he wasn't thrilled about his result. So we did what's called the MaxHarvest Plus procedure, where we move as much hair as possible to help restore what he was trying to bring back. So we completely recreated his hairline, reframed the face. He had some loss in the crown, which we also addressed as well. How did you feel we did for you?
I felt great. I mean, like I told you before, completely changed my life. And that's why I'm back. Second time.
It's my favorite thing to hear out of a patient's mouth is you completely changed my life. And I hear it all the time, and people say it's corny when someone says that. And I say, it's not corny. It truly affects people's every day. When they look in the mirror and they feel like they don't have their confidence because they lost their hair, and he's a very handsome, tall man who has lots of confidence, but it brings you down when you lose your hair. And when you get it back, it changes your daily life,
Changes
right?
everything.
It really,
everything.
it's true, right? It's
100%,
crazy.
100%.
So anyways, what was the difference of our procedure versus what you had with the Bosley procedure?
Just like you said, so just that one procedure, well, you'll see the before and after photos.
Yes.
The coverage, that started the process, right? Because I already knew, we already talked about that, I was gonna have to come back again.
Yes.
But just the coverage of one procedure, what it did compared to Bosley.
Okay. And did you have an FUE or did you do a strip?
The strip.
With Bosley?
Yeah, the strip.
Okay. And so in comparison to the amount of hair that you got from your Bosley procedure versus mine, how would you categorize that?
So if I'm not mistaken, I think it was only, and I could be wrong, it was only like 15 or maybe 1,800 grafts.
1,800,
yeah,
okay.
Compared to yours,
okay.
to the MaxHarvest.
Yes. So that's a typical thing that they'll do, is they say, I'm going to give you 1,800, 2,000 grafts, but you don't know how many hairs are in each graft. Are they all 1 hair grafts? Are they all 2 hair grafts? And that's one of the things I always talk about, is I try to base mine on the amount of tissue that's moved, and then I base that on an average number of 200 hairs, which shows in all the studies that the average adult male with average hair density should get about 200 hairs per square centimeter. So when we do a big case like what we did on Will, we moved over probably about 70 square centimeters of tissue. On average, to get you about 14,000 hairs. Does he get 14,000 hairs? Who knows? It could be less, could be more. We're not counting what's in that strip because whatever's in there he gets, and it's just not a good use of time to do that. But anyways, here's his result. We were able to completely reframe his face. Everything you're seeing here is brand new. We put this new hairline on him to make it so it kind of reframed it and got rid of his forehead. His hairline was higher before. When they do those smaller cases, they have to put the hairline higher because they won't be able to connect it. So when I have more hair to work with, I can get more creative with how I put the hairline and so forth. Here's his other side, so you can see how it looks on both sides. Nice, soft, natural, reframe the face. I love that he said, hey, you told me I needed a second procedure, because I tell everyone that. It's one procedure is not a finished product in any case, because there's only so much we can do. Even when I do a big case, I have limitations, especially when the patient wants multiple areas.
And my hair was completely gone.
And yes, yeah.
So it was a huge case.
It was a nice big case, man. And this is his crown, and if you can kind of tip your head back a little bit. So, a lot of the patients are always saying, well, Dr. Bolton does an older style, and you can see the graft. This is the result. These are my density grafts back here. Okay, if I were to use a follicular unit back here, he would have 0 result, because the follicular units are, 1, 2, rarely 3, 4 hairs. What I do in the crown, now I'm just gonna put you back just to drop,
sure,
is I use a graft that has multiple follicular units, where I'm able to get a much better result in a single procedure. Keep in mind, I filled this whole crown and restored the hairline in a single session. That's the base. When we come back today, we're going to kind of tighten everything up and fill it in. While I have him here, let me show. I haven't seen a suture line. I always do this live. Everyone's so freaked out about these suture lines. Let's take a look at it. Okay, so Here's the suture line. He had a previous procedure with Bosley. They took him down here. My suture line. This is it right here. If you look here, this is the suture line. Comes across. Okay. This is the suture line here. Keeps on going. And it just goes like that. And then it comes all the way around, all the way to the other side. So completely undetectable. You don't have to shave your head to get the donor hair, because I just shave what I need and then it folds back over. He does not have to shave his head today, which is what they're doing when they do an FUE, is they completely shave your head. So we're able to get the patient back to life sooner than if we were to use the method of FUE, which I'm a strong advocate against, because I can never get a result like this with that harvesting technique. So I've been telling you I'm getting a lot of bad rap on the internet that's false. What do you say to the patient that's sitting at home who's experienced what you experienced about whether or not they should have a hair transplant with us?
Well, just to start, before I came to you, obviously after Bosley, I did a lot of research.
Yeah.
What was the best way? What was the best method? And your name kept popping up, again and again and again. So obviously I looked you up, did my research, and then came the first time. Beautiful.
Awesome, man.
Beautiful job. No problems, no issues. Felt real comfortable, really at home. What I would say is there's no one better. There's no one better, and I trust completely. And I'm coming from California. This is my second time, and if anyone knows that, I'm sure you get a lot of people coming from other countries or whatever for you to fix them. But coming across country isn't easy, especially having kids and working, and
Yes.
so to come here to you and all the way from California is should say something.
Thank you very much.
No problem.
I appreciate that. It means a lot. I'm so happy you're happy. As you know, I was so excited to see you.
You're right.
See your result.
Yeah, me too.
It just makes my day, man.
No
And
problem.
I'm so happy to do this.
No problem.
All right. Thank you so much for doing the video. I really
no
appreciate
problem.
it.
Thank you, Doctor.
I'm gonna
I appreciate
do
it.
another awesome job
can't
for
wait.
you.
I can't
appreciate you flying out from California. I take that very seriously. And I'm going to do another awesome job for you.
Thank you, man. I can't wait.